The engaged patient makes the best patient. I, as a doctor, can prescribe all I want. In the end, it's up to the patient to really take the medicines on time, to follow the appropriate lifestyle, to contact us when needed.
We have over 250,000 admissions a year here, and congestive heart failure represents the number one of all of those, and it's well over 5,000 admissions a year.
Those days you don't feel good. There's a lot of people that get the heart failure. I was the same way when I first got it. Like, I'll take my pills. Pretty self-explanatory if you do everything right. But a lot of times people don't.
I think we've done a good job of telling the patient about their disease and what is their role in managing the disease. But when you actually go and ask them afterwards how they've done, we find that there are significant gaps. I think the Simcoach team has done an incredibly good job of bridging that gap.
Because of the success we've had in driving sustainable behavior change with games and other applications, we wanted to bring our platform to patient engagement. Games are different from traditional education because they're participatory. Games are designed to help us learn. In the game, players take care of a virtual character named Simon and help him reinforce 3 critical skills related to heart failure's patients staying out of the hospital.
And there's been no better way, in my experience, to understand the consequences of an action than to be able to play a game. When we first started up to pilot our game at UPMC, we had some very early promising results. And when we saw that patients actually did not return to the hospital as often as we had seen prior to them using the educational piece, we actually said there's something to this. We've got to go deeper. We've got to understand it.
The gains in terms of lifestyle changes, in terms of medication adherence, and in terms of when to call us in times of trouble seems to be a sustained effect. We've deployed this at various iterations for about 8 months now, and in that time frame the gains seem to be sustained. And consistently, and I can say this without reservation, 100% of my patients love the game. The bottom line really is that this is adding value in terms of patient education.
We wanted to work with UPMC because they're committed to helping their patients play an active role in their own health.
I think it's pretty cool. I like it. I think it should make everybody, when they come in, take it.
Well, you know, at this point in time in healthcare's evolution, I believe that patients being in control of their own healthcare is probably the only way we're going to fix it.